I'm Dr. Michael Weiss. I'm professor of neurology at the University of Washington Medical Center in Seattle. So RAISE-XT is the open label extension to the RAISE study, which is the randomized controlled trial looking at Zilucoplan 0.3 milligrams per kilogram daily versus placebo. And then those patients, after 12 weeks, were given the option of going into RAISE-XT and getting on the drug without any placebo and being followed in open label extension for as long as they wanted to be in it. And now there's assessment of the data at week 120. And that data has been looked at for a number of different metrics, but what my presentation focused on was fatigue. And fatigue has been shown in RAISE, the randomized controlled trial, to be dramatically impacted compared to placebo. And the way it was assessed was looking at the NeuroQLL short form for fatigue, and then taking that raw data, which is categorical data. So this patients answer a question, I think it's 0 to 4 for each question. And then that data is converted into T-scores. So that is based on what has been done in the MS world to assess fatigue, and allows for more granularity as well as for assessment of clinical meaningfulness. So we know that based on this validated way to convert this raw data into T-scores, that if you have a T-score reduction of at least 3.5 points, then that is clinically meaningful. And so that was looked at in the study, and over 75% of patients reached that point by week 120. And it had been shown that a significant percentage had reached clinically meaningful significance, maybe not as many, even after the 12 weeks of the RAISE randomized control trial, but then in open label extension, that effect was sustained throughout the entire course of the open label study itself. And then the other thing that was noted was that there was a significant reduction in every single patient in the study by week 120 of the severity grade of fatigue and that was graded as none, mild, moderate, or severe, and every patient had a decline in their severity grade. And initially, at baseline, there were 26% of patients who had severe fatigue, and by the end of the 120 weeks, there was only one patient, or less than 2% of all the patients, who made it to the 120-week mark, and that was, I believe, 61 patients. So that's pretty impactful, at least I think so. And so the effects on fatigue seem to have been sustained throughout this period of time. Patients had a very similar impact as they did in the RAISE study itself. And then that effect was quite clinically meaningful for most of the patients. A muscle weakness can be assessed on clinical examination. You can assess it by doing just manual muscle testing, which is you're grading muscle from 0, where the patient's not moving their muscle at all, to 5, which is normal strength. And that's based on the Medical Research Council out of Cambridge University from decades ago, and it's widely embraced throughout the world as the bedside assessment of muscle strength. But you could also do handheld dynamometry, where you could quantify muscle strength that way. Whereas fatigue is really more of a nebulous term, and it's sometimes hard for patients to describe it. Sometimes they mean that their muscles are feeling weak, even if it's not appreciable on exam, or that they are feeling tired. Occasionally it means that they're feeling sleepy. But because the impact of fatigue mirrored the impact of the drugs, Zilucoplan, on the other metrics that were assessed in RAISE, like the MG-ADL score, the QMG, and MG composite, an abrupt decrease after one treatment. It seems that is due to neuromuscular fatigue, because it was impacted, the fatigue, because in the same way that these other metrics are impacted. And that would not be the case if it was related to anything else that we talked about, like they have a sleep disorder, or another consideration might be depression, reactive depression. So that would not respond so quickly. So we think that it's related to the actual neuromuscular fatigue that patients are experiencing. The patient quality of life study, that looked at the MG quality of life 15R, in a very granular fashion. So it looked at the questions from that scale and identified questions and ranked them based on severity from less severe, and that would be the majority of patients with milder MG, to more severe patients with more severe MG. And it asked patients at the beginning of the study, at the beginning of RAISE, and then and then at the end of RAISE XT, and out to 60 weeks of RAISE XT, the open label extension, whether they had specific symptoms none of the time, some of the time, or were they affected very much by those symptoms. And those included things like being able to talk, being able to plan their day, and a number of other quite similar items on the MG-QOL-15R. So we knew from RAISE itself that the MG-QOL-15R, this absolute score, decreased significantly with treatment with Zilucoplan compared to patients on placebo. But this is a different approach because it basically teases out what patients are experiencing that is based on the MG-QOL-15R. And it just provides information about how that score translates into specific symptoms. And so what was shown from the baseline of the RAISE to the end of RAISE, which is after 12 weeks of treatment, that there's this shift from patients, especially with the questions that reflect more severe disease. So placebo patients would say those patients are suggesting that they would have the answer to those questions not much of the time, far less than the patients on Zilucoplan. So by the end of RAISE, the RAISE patients were saying that they were having these symptoms not much of the time, way more so than the patients who were getting who were on placebo. And that was even more true in RAISE XT by week 60, so that the most severe symptoms that they're experiencing that are reflected in MG-QOL-15R, for the last 7 questions, more than 50% of the patients who were on the study drug, on Zilucoplan, said that they didn't have these symptoms not much of the time, or really not at all. So they were experiencing far fewer of these very devastating symptoms by 60 weeks out from the onset of RAISE XT. So they haven't looked at the 120-week data yet, but so far it looks like the effects there's gradual improvement in the scores on MG-QOL-15R over the course of RAISE XT. And so the effects is sustained, and it actually improved over those 60 weeks compared to the response at the end of RAISE week 12.